Paris, in a stark warning issued Wednesday, the European Union's Food Safety Agency, EFSA, highlighted the looming spectre of a widespread avian flu pandemic should the virus acquire the ability to transmit between humans, exploiting the lack of immunity among the human population. This cautionary announcement follows closely on the heels of a troubling revelation from Texas, where health authorities confirmed the detection of the H5N1 strain of avian influenza, commonly referred to as bird flu, in an individual who had come into contact with dairy cows suspected of carrying the virus. The ramifications of a bird flu outbreak extend far beyond mere economic concerns for governments and the poultry industry, encompassing the potential devastation of entire flocks and the ominous threat of human transmission. While the current season has seen a relatively lower number of bird flu outbreaks, the geographical spread of the virus is worrisome, with reported cases even reaching Antarctica. Furthermore, there is an alarming trend of the virus infecting an increasing array of mammals, heightening the risk of it mutating into a more formidable threat to human health. Up to the present moment, sustained human-to-human transmission has not been observed, and instances of bird flu transmission from infected animals to humans remain rare. Nevertheless, EFSA underscores the ongoing global evolution of these viruses, noting the potential for newly emerged strains, facilitated by the migration patterns of wild birds, to harbor mutations conducive to adaptation in mammalian hosts. If avian A, H5N1, influenza viruses acquire the ability to spread efficiently among humans, large-scale transmission could occur due to the lack of immune defenses against H5 viruses in humans, EFSA emphasized in its report. According to the latest report from the World Health Organization, WHO, a total of 887 cases of human infection with H5N1 avian influenza were documented globally between January 2003 and February 26 of the current year. Alarmingly, of these cases, 462 proved fatal, accounting for a mortality rate of 52%. The bulk of human infections were identified in individuals with unprotected exposure to sick or deceased poultry, live poultry markets, or contaminated environments. EFSA further highlights the potential role of wild mammals as bridge hosts, facilitating transmission between wild birds, domestic animals, and humans. Even companion animals like household cats, particularly those with outdoor access, could potentially serve as vectors for transmission. In addition to poultry and dairy cows in the United States, other mammals afflicted by the virus include goats, cats, foxes, raccoons, skunks, as well as polar and grizzly bears, along with elephant seals. EFSA urgently advocates for bolstered surveillance efforts encompassing both humans and animals, ensuring access to swift diagnostic capabilities, fostering collaboration between the animal and human health sectors, and implementing proactive measures such as vaccination campaigns. The European Union's Food Safety Agency, EFSA, issued a stark warning on Wednesday, cautioning about the looming spectre of a widespread bird flu pandemic should the virus acquire the ability to transmit between humans, exploiting the vulnerability of our immune systems. The alert follows a recent revelation from Texas, where health authorities reported the detection of the H5N1 strain of avian influenza, commonly referred to as bird flu, in an individual who had direct contact with dairy cows suspected of carrying the virus. Beyond avian populations are of grave concern to governments and the poultry industry alike. The sheer devastation it could wreak upon flocks, coupled with the looming threat of human transmission, has set alarm bells ringing across the globe. While this season has witnessed a lower number of bird flu outbreaks, the geographical expansion of the virus, even reaching Antarctica, and its transmission to an increasing array of mammals, underscore the potential evolution of this threat into a more significant danger to humans. Despite no sustained evidence of human-to-human transmission to date, EFSA highlighted the continuous global evolution of these viruses. With the migratory patterns of wild birds facilitating the potential selection of new strains with mutations favoring mammalian adaptation, the risk looms large. In the event that avian A, H5N1, influenza viruses develop the capacity for efficient human-to-human transmission, the consequences could be dire due to the absence of immune defenses against H5 viruses in humans, EFSA stated in its report. According to the latest report from the World Health Organization, WHO, there have been 887 reported cases of human infection with H5N1 avian influenza since January 2003, with a staggering fatality rate of 52%, accounting for 462 deaths. Most cases of human infection have been traced back to individuals with unprotected exposure to sick or dead poultry, live poultry markets, or contaminated environments, underlining the need for stringent preventive measures.